Dr. Milhan, it's so wonderful to have you on this medical panel. One of the questions I'd like to start with asking you is, what is your Bemer story? And just a little bit about that would be wonderful for our audience.
For sure. So about 3.5 years ago, one of my patients who had seen me go through lots of trials and tribulations with back issues came into my office one morning and said, "Hey, Dr. Judd, I'm going to introduce you to someone that's going to help your back." So that's how I was introduced to Bemer. And I let an individual guy by the name of David Easterbrooks, who's legendary in this company, come into my office and show me the Bemer. And I was on it for 8 minutes Monday through Friday, and maybe 8 minutes Monday, Tuesday, Wednesday of the next week. And I had to leave town. I was on the Pacific Ocean, trying to catch a marlin in a very small boat, pounding in the waves for 3 days. And the guide said to me, "Hey, look, it's not marlin season. Come back in October." So I went to the hotel room and I told my wife, Leslie, I said, "My back should be killing me. I mean, it's not killing me. Do you think this dude with the mat is onto something?" So that's when I started reading and researching Bemer and PEMF. And, I understand a little bit about the circulation, and I just thought it was the right thing to do. And I bought one for myself, and it's absolutely changed my life.
Thank you for that. Really appreciate that, Dr. Milhan. Why have you chosen Bemer technology versus any other pulse electromagnetic field device or tech?
Well, I think the effect on the microcirculation and vasomotion, the prolonged effect with the Bemer signal, trumps every other device. And I remember a trial that compared Bemer and 4 other competitors, looking at the effect of the signal with the vasomotion and the microcirculation flow, that it made perfectly good sense to me that the Bemer patented signal is the best.
Thank you. And I know yourself as a cardiologist, you don't necessarily use Bemer in your clinical practice. However, you and I have spoke about you're making recommendations to your practice. If so, how has Bemer impacted your patient's health and your practice revenue? For you, it's not your practice, it's more your patient's health that I would ask about.
Right. So I'm an employed physician with a large healthcare entity here in Ohio. So during my work hours, I cannot discuss Bemer or any other potentially conflict of interest medical device. So I've shared Bemer with my friends, family, and patients after hours. And I've seen incredible results with all of those groups, personally, family, friends, and also patients. The Bemer signal, the effect on circulation has improved lots and lots of medical conditions that don't need to be named, individually, but it's been a very positive effect for most of the people I've shared Bemer with.
Fabulous. And again, not to get into any direct medical observations, but what outcomes have you observed with yourself and your patients as far as Bemer therapy? General wellness, maybe more energy, these types of things, more about lifestyle and supporting as an adjunctive tool for one's healthy lifestyle.
So correct. I obviously really advocate a healthy lifestyle with diet and exercise and water and hydration and all that, but I think Bemer is a perfect fit as an adjunct to a good lifestyle. But what I've seen, most notably for most of the people I've experienced Bemer with, is increased energy. That's probably my number one effect in the people that I've shared it with. I've seen lots of other effects: improved sleep, improved flexibility, better performance during exercise, and shorter recovery. Those are the main things that I've seen in the last 3.5 years I've been sharing Bemer.
Wonderful. As far as we talked about your medical practice a bit, do you recommend Bemer to other doctors or your colleagues? We certainly know you recommend Bemer to your patients. And if so, either your colleagues or patients, how do you support or convince them to look at the product or use the product?
So with my patients, most of them have seen a distinct improvement in myself. So I see people on a yearly basis, and they come in and they say, Dr. Judd, you're smiling, you're getting in and out of the chair. What's happened to you? How's your back so much better? And so that's the initiation of a conversation that occurs outside of my work hours, and that's how I introduce patients to Bemer. My colleagues are a tough group. Like myself, they're not as willing to look at sort of the non-traditional or adjunctive therapies that could help, because they're expecting these large, multi-center, randomized, placebo-controlled trials, and if they don't see a lot of those, they're not willing to really open their eyes to it. And the reason that I opened my eyes to Bemer is because I was desperate. I tried everything I could think of, and the traditional type of therapies did not help. Bemer was just incredible in how it turned myself around. So the few colleagues that have come over to my house and seen the Bemer and been on the Bemer have seen positive results. So I think it's a large hill to climb, but I'm willing to push that rock up the hill until we get all of my colleagues and all of the traditionally trained physicians to really think about the positive effect and the adjunctive effect of Bemer.
Well said, Dr. Judd. And the proof, they say the proof is in the pudding, or in this case, the proof is in the signal. And you explained some very wonderful aspects of how you personally were affected with Bemer in a positive way. Is there any specific medical cases that come to mind that impressed you with Bemer therapy?
Yeah, I mean, one of the first people that I shared Bemer with was one of my mom's friends. And at the time, she was 96, and she was living independently at home in her house about 3 blocks from my house. So I brought the Bemer over to her and set it up, and I went to her house every 3 days after work, just making sure she was doing it correctly. And she had some issues with her back, and that's what prompted her to use the Bemer. So over time, her back improved, not substantially, but she saw amazing results. For instance, her vision at night improved to the point where she started driving again, which is amazing at 96.
That's right.
She had issues with her intestines that had been plaguing her for years that were just resolved. So my experience with Bemer is sometimes it doesn't always work as effectively or to the positive effect that people would like to see on the specific reason they're using it, but they see the positive effects in other areas of their body and their health, and they see the positive effect.